Welcome to Module 6, HIV/AIDS. This is Dr. Aditya Ditti, Assistant Professor, Department of Chemistry, St. Joseph's College for Women Autonomous, Visakhapatnam. Coming to the last chapter of Module 6, Chapter 6.4, Immunological Abnormalities, Symptoms, Diagnosis, and Structures of some protease inhibitors. The contents of this chapter are 6.4.1 deals with the immunological abnormalities, 6.4.2 deals with symptoms and diagnosis, 6.4.3 deals with the structures of protease inhibitors, indivanir and nelfinavir. The outcomes of this chapter are: in order to learn the immunological disorders of AIDS and its diagnosis, to learn the symptoms of this disease, prevention of this disease, and the structures of protease inhibitors, indivanir and nelfinavir. Coming to the immunological abnormalities in AIDS. AIDS primarily affects the cell-mediated immune system, which protects the body from intercellular parasites such as viruses, protozoans, and mycobacteria. This is caused by reduction in CD4 cell of T lymphocytes, besides impairment of or in the functions of CD4 cells. The viral membrane protein GP120 binds with the normal T helper cells. CD4 cells may be regarded as the master cells of cell-mediated immunity. Now coming to the abnormalities of CNS, central nervous system. HIV infects central nervous system. It is believed that HIV-infected monocytes enter the brain and cause damage, the mechanism of which remains obscure. Transmission of HIV. HIV transmission occurs when blood, semen, preseminal fluid, vaginal fluid, or breast milk from an infected person enters the body of an uninfected person. HIV can enter the body through vein, that is nothing but injection, the lining of the anus or rectum, the lining of the vagina or the cervix, the opening to the penis, the mouth and other mucous membranes, cuts and sores. These are few methods of HIV transmission. Here the usage of non-sterile syringes, pregnancy breastfeeding, blood transfusion, organ transplant, unprotected sex. And HIV is not transmitted through food, drink, utensils, insect bites, kiss or touch, clothes or towels, toilets or shower. The clinical picture. Incubation period is from 6 months to more than 2. AIDS occur in homosexual, bisexual males, heterosexuals, intravenous drug users, and homophiliacs treated with blood products or factor VIII are also at risk to get infects. These are the common ways that HIV can be transmitted from one person to another. The very common way is by having sex, with a HIV infected person by sharing needles or injection with a HIV infected person by blood transfusion and when HIV infected women feed their babies. Now coming to the symptoms of HIV, illness include fever, headache, rashes on the skin, joint pains, sore throat, myalgia that is nothing but muscle pain, occasionally encephalitis that is nothing but brain fever. These are the symptoms of HIV: night sweats, sore throat, mouth ulcers, swollen lymph, and gastric problems. Now coming to the prevention methods. HIV contaminated waste products are to be sterilized and disinfected. HIV is heat sensitive and can be inactivated at 37 degrees centigrade for 10 minutes with 10% household bleach, 50% ethanol, 35% isopropanol, 1% NP40, 0.5% Lysol, 0.3% H2O2, that is hydrogen peroxide. Besides, extreme pH heating at 56 degrees for 10 minutes can inactivate HIV. Blood used for transfusion must be tested for HIV virus. These are few ways to prevent HIV. Use protection for safe sex. Use sterilized needles and never share them with others. Choose your partner wisely. PEP or PrEP. Take medicines that can protect you from HIV exposure. Pre-exposure prophylaxis is nothing but PrEP and post-exposure prophylaxis is nothing but PEP. Check for HIV and other sexually transmitted diseases on a routine basis or whenever you are at risk. HIV prevention is better than cure, so take necessary precautions. Now coming to the laboratory diagnosis for AIDS. There are different methods: direct methods, cultivation of T lymphocytes, detection of reverse transcriptase, solid phase ELISA, useful to detect HIV antigen. Indirect methods: ELISA, enzyme linked immunosorbent assay, is nothing but ELISA. To screen for AIDS, a blood sample is centrifuged to separate serum from blood cells. Serum is then subjected to an initial ELISA screening procedure to detect antibody to HIV virus. Any blood sample that is reactive on the testing is presumed positive for the antibodies to virus, indicating the individual has been infected with AIDS. Western blot assay is one of the indirect method, otherwise known as immunofluorescence assay. This procedure involves the isolation and testing of individual viral proteins to determine if the antibodies initially discovered in ELISA tests will recognize HIV specific protein antigen and bind to proteins considered to definite sign of infection. There are two other methods. One is radio immunoprecipitation assay, which involves radioactive antigen, and PCR polymerized chain reaction or Western blot strips. New and existing technology detects actual virus rather than detecting antibodies. The PCR polymerized chain reaction provides the direct measure and the presence of viral DNA in the body. This process is fast and accurate and expensive even. Now coming to the structures of protease inhibitors. Here we'll be learning about two structures of protease inhibitors. Before going to the structures, let us now understand what do you mean by protease inhibitors. Protease inhibitors prevent the cleavage of protein precursors, which is essential for HIV mutarotation, infection of new cells, and replication. In clients with advanced HIV infection, a protease inhibitor has led to marked improvement and prolonged survival. All protease inhibitors can cause increased bleeding in hemophilics and hyperglycemia and new onset or worsening of diabetes. Now coming to our structures, the first one is indinavir. Indinavir is a potent protease inhibitor when used with AZT or stavudine and lamivudine, lowering the rate of disease progression and mortality more than two nucleoside analogues alone. This triple combination effect has been durable, and an early fall in plasma HIV RNA to undetectable levels can last more than 2 years. Kidney stones have been reported in 4% of clients, and asymptomatic elevation of indirect bilirubin occurs in about 10% of the patients. Here you can observe the structure of indinavir. This indinavir is otherwise known as Crixivan. And the other protease inhibitor is nelfinavir. Nelfinavir, otherwise known as Vyricept, is active in combination with many other nucleosides and protease inhibitors. Diarrhea has been the main side effect by using this nelfinavir. And here you can observe the structure of nelfinavir. This is a brief story of HIV positive and negative persons. You can just look at this GIF. And this is how we can bring this epidemic to an end. Thank you.